Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab, all on your time, live or on demand. This is CSIS Online.
Welcome. I'm Caitlin Welsh, Director of the Global Food Security Program at CSIS. Today's webinar will address the threat of antimicrobial resistance in low and middle income countries. As swine and cattle production intensifies, responsible use of antimicrobials is critical to safeguarding food production, food safety, and food trade. For this reason, in 2015, the World Health Assembly urged all member states to put in place national action plans on AMR. Many low and middle income countries are poorly equipped to address problems related to AMR, and national action plans are important for defining and aligning investments. But have they done this? Today's event will focus specifically on the role of national action plans in driving national level action against AMR. Have these plans been effective? If not, what else is needed to curb the threat of AMR in developing countries? I'm personally invested in this topic. In my previous job in the US government, I helped negotiate leaders' outcome documents at G7 and G20 summits. For example, at the 2018 G20 summit, we negotiated the following language. G20 leaders commend the progress made by the international community in developing and implementing national and regional action plans on AMR based on a One Health approach. Negotiators spend long hours negotiating language like this. So I'm interested in learning about real-life implications of leaders' words. With me today are Arshney Moodley of ILRI and CGIAR, and Emerfin Mpundu of REACT Africa and ICARS. There are none better equipped to discuss AMR in developing countries, particularly developing countries in Africa, than these two experts, and I know we'll cover a lot of ground with them in the next hour. I'd like to check right now to see if the ambassador has joined us. Okay, don't think so quite yet. We'll be very pleased to welcome the Danish ambassador to the United States in a few moments. First though, I'd like to turn to our first guest, Arshney Moodley. She joins us from the International Livestock Research Institute in Nairobi, Kenya, where she is the team leader on antimicrobial resistance at the CGIAR AMR Hub. Arshney is a microbiologist with a PhD in antimicrobial resistance and zoonosis. Arshney, it's an honor to have you with us today.
Hi, Caitlin, and good evening from Nairobi.
Yes, good evening to you. So by way of introduction, would you mind briefly describing for our audience your job with CGIAR?
So firstly, for those of you who don't know what the CGIAR is, a global partnerships to address poverty and food insecurity through sustainable agriculture. And this is in the global south, of course. And here we have established almost 2 years ago an antimicrobial resistance hub, which is focused on agricultural associated antimicrobial resistance challenges in low and middle income countries. And that's everything that's related to addressing those problems here in our context of where we are.
Okay, great. Thank you, Arshney. Let's dive into talking about national action plans. You and I have had a few conversations before, and we've talked about the value of these plans. We've talked about ways that they might actually hinder progress. So can you speak a little bit about each? What's the value of these plans, and in what ways might they have actually served as impediments to progress?
I think there's been a lot of discussion about these national action plans now because a lot of them are almost coming to the end of the period from which they were established. So personally, I think there's a great value in them because that allowed governments the ability to sit down and focus on developing a plan to address a very specific issue. And probably the few times where you had at a table both the Ministry of Health, the Ministry of Agriculture, and various other stakeholders to discuss this one topic. So yes, I think there's value in it. And it's brought this sort of this multi-sectoral approach, One Health approach to addressing a particular problem.
Okay, thank you. So, this might be a little bit, I don't know if controversial is too strong a word, but are there instances in which you think that having the plan in place gives the signal that the work is done here. We have the plan, and then therefore progress will just happen on its own. Have you seen that instance?
I wouldn't say I've seen it and have sort of data to show that, but I think there is part of the tendency, or when if you look at whether these action plans have been implemented, and this is in many cases, particularly in low and middle income countries, no, and there's a number of reasons why. So it's good to have a plan, it's good to have a document that says, this is what our roadmap, but whether it's actually been implemented is a completely different story. And why that is not to sort of be talked negatively or anything like that. I don't think it's impeded it. It's just because there's no resources or various other challenges that impedes that.
Okay. Thank you. Thanks for clarifying that. So then beyond the creation of a national action plan, there are many other things that need to be in place in order to drive action against AMR. So I'd like to discuss a few of those. Can we start with funds and making the best use of funds? What are your thoughts there?
So I think if we look at a lot of the AMR programs that are currently ongoing in low and middle income countries, they're mainly donor funded. They are not funded by the governments themselves. And therefore one can question what is then the agenda. And I think one of the things could be is that donors sit down with the countries and address what are the sort of challenges or what are the needs of the country in order to adapt a project or a plan that then represents what the countries need to have better sustainability of the entire program once the project ends. So I think that is an important point that has to be taken into consideration.
Okay, certainly. And now data is an enormous challenge. I think it's something that's really technical and a lot of people don't have patience for conversations about this, but it's incredibly important. And I find when it comes to AMR, the amount of baseline data that we have to understand where we're starting in developing countries is really, really low. So what are your thoughts on improving data to inform plans and inform the action we need to take?
I mean, in order to evaluate whether any intervention is working or not, you need something to sort of measure it against. And so this is the importance of having baseline data. And there are a number of initiatives currently going on to gather that. But there are major sort of challenges with gathering data, also the storage of data. So in many instances, there's no digital sort of framework where this data can be stored. You still have a lot of paper-based mechanisms, or simply it's just not recorded. So we have to address all of those basic needs. How do we capture data to how do we store data? And I think very importantly, how are we going to share data within the country, within the region, and globally? So I think there are many challenges that should be addressed about data.
Well, yeah, and certainly when we talk about a One Health approach, it implies communication among sectors within a country, and if you don't have processes in place to share data, then how will you be doing that? I want to get to the One Health approach in a minute, but first I want to talk about something that I've heard you speak about before, which is how to address training when it comes to AMR in low and middle income countries. So what are your thoughts and what are your experiences there?
I think one of the things that have, based on our experience, is that training is not enough. Offering knowledge on a platter is simply not going to be enough in order to change behavior. And I think we all know that we shouldn't eat that piece of cake, but we do it anyway. So I think one thing is the knowledge and increasing knowledge. The other important thing is to understand, well, what are the incentives and that need to be in place in order to change a behavior? And that is incredibly different. And I know that there's a number of organizations working to understand drivers of use, incentives for behavioral change. And we're slowly trying to unpack that now.
Okay, thank you. And then, when you think about working with livestock producers, for example, within low and middle income countries, would you mind sharing your experience with who is best to target on farms with this training?
I think we have to consider the different players, the different actors within this very big, complex value chain. Is one thing, it's the farmer, and to increase his knowledge about animal health and also the benefits of improving his husbandry practices to prevent infection. That's very important to do. The other thing is to improve access to veterinary services. So in certain areas here in Africa, there may be one veterinarian that is serving thousands of farms. He simply doesn't have the capacity to visit all of them. So that is another area that we need to focus on. We also have to understand what are the incentives of the prescriber, the people who sell the antibiotics. We know that the knowledge amongst them is very high, so they understand, about rational antimicrobial use. But when you look at their practices, not, sort of their prescribing practices they don't align very well. So I think there are many different things that need to sort of happen at the same time in order there to be this movement to reducing use, reducing resistance levels in animal populations, and then also in food safety and various other sectors.
Yeah, and you've mentioned before the importance of considering gender when you're doing these trainings, because often the person who purchases the animals is not always the person who cares for the animals. So would you mind commenting on that?
Definitely. So one of the things that we see from our research is that the person who owns the farm is typically a man, although the person that looks after the animals, depending on the animal species, will be women. The person or the gender that accesses antimicrobials is men. And when we do training, we typically will see a man coming to the training and not necessarily the women. So I think there is this idea of having a gendered lens on how we approach our training or our actions or initiatives when we want to have a behavioral change. And this includes the language that we use, the person that is delivering the training. There are all of these sort of nuances that have to be taken into consideration if we want to have effective uptake of any of the interventions that we want. So we have to have this gender perspective, which I think is coming slowly in the sort of arena of antimicrobial resistance. But we sort of have to tie that in with a lot of the other research within livestock, sort of rearing or aquaculture or just agriculture in general.
Yeah. Okay. Thank you. Thank you for sharing that. Last question for you for now has to do with the One Health approach. And I find that when it comes to development related challenges in low and middle income countries, one thing that practitioners love to say is that we need to break down silos between sectors, because we can't address these multifaceted challenges just through one lens. Now, the One Health approach embodies a multi-sectoral approach to a multi-dimensional challenge. I'd like to hear about your experience working across disciplines to address the challenge of AMR.
I mean, for us, yes, one health, right? So the understanding that we're connected and therefore interventions in one sector will have an effect in the other sector. So that is the ideal way of moving forward when we discuss AMR. Whether that is actually possible to implement in practice, that requires multi-sectorial, multi-actor collaboration on this one coordinated approach. So yes, so this is the way we're working now. Happy people, happy animals, happy environment. So that is kind of the motto for everybody working within the One Health sphere. So we have a number of initiatives on the continent, networks that we're trying to tap into to understand how can we deliver a cost-effective One Health approach. And I think the important word is cost-effective, especially in a low and middle income country. And that can be addressed with this One Health approach.
Okay, great. Thank you so much, Arshney. Look forward to turning back to you in a few moments. I'm going to speak with our second panelist today, Myrfin Mpundo, and then I'll have the pleasure of turning the mic over to the Danish ambassador to the United States. So we'll start with Myrfin right now. Myrfin is based in Lusaka, Zambia, but he's joining us today from Washington, D.C. He is the head of REACT Africa, which is that stands for Action on Antimicrobial Resistance in Africa. And he's also partnerships and stakeholder engagement lead for ICARS with responsibility for Africa. He's a public health specialist with over 20 years of experience on global health policy and diplomacy. And Myrfin, thank you so much. I'm honored to have you with us today.
Thank you so much. It's my pleasure.
Thank you. By way of introduction, can you briefly describe your job with REACT Africa and with ICARS?
Yeah, my job with REACT Africa involves supporting countries at the policy level with the development of national action plans, but also with implementation, but also development of other strategic policies that impact on antimicrobial resistance. And the other things that I do is that, we work with civil society organizations, creating a platform of engagement. We work with the intergovernmental organizations, in ensuring that we promote the AMR agenda in the region. And with ICAS, ICAS is a new organization about, just a year and a half or so. The ambassador will talk about it a little bit more, but just to say, needless to say that I actually engaged different countries in Africa to interest ICAS to them and to start actually forming the collaborations and partnerships with them. And so we can actually support them with implementation of their National Action Plan through the application of demonstration projects in the region.
Go ahead. I'd like to dive right into questions. I think that you and I were on the same wavelength. The title of our event today is Moving from National Action Plans to National Action. You wrote a paper just a few months ago entitled From Paper to Action. In your opinion, what are the most important steps to address AMR following the adoption of a National Action Plan?
Yeah, firstly, I think it's been quite encouraging to see that a number of countries have developed national action plans. But however, very few countries have started the implementation. And I think one example can be looked at the African region, where with 33 countries at the last count had developed their plans. And out of those, really 16 countries had them politically endorsed, and then 13 technically endorsed, but only about 5 countries were actually implementing them. And I think one of the reasons that one would look at is that these plans are robust in paper, but they are not implemented at all because of a lot of, mostly because of so many reasons that Arshney had mentioned. But needless to say that, one of the fundamental problems is that of lack of political buy-in, and also lack of coordination and strong governance structures. Most countries have got what is called an AMRC, an Antimicrobial Resistance Coordinating Committee, or whatever they call it in any different country. But essentially, this is the governing committee. It's a technocrat group. And above that, you've got the ministerial committee that actually watches above this group. Unfortunately, what you find is that these coordinating committees are hosted in one ministry with a focal patient for the country in terms of AMR. And unfortunately, the focal patients in most countries actually, they stem from microbiology, and these are hosted in ministries of health. And so you find that they default in their strong areas, and they focus largely in the Ministry of Health and not the other ministries. And so one way to actually strengthen that is that the political buy-in I'm talking about, it's not enough just to actually endorse and stand at the ceremony, but it's to be able to provide resources. It's to be able to support it by providing both the human and financial resources. It's the country has to cost and prioritize its activities. It has to involve the ministries of finance, which are rarely involved, and the ministries of national development and planning. These are ministries that are not mostly actually engaged in these processes. But it also a country has to look at, in form of implementation, we also have to make a strong business case for investments into the interventions, be able to do some cost-benefit analysis, and also look at the cost of missed opportunities. These are some of the crucial steps, and also we have to engage all stakeholders. And this involves, academia, agriculture, environment, civil society, the communities, and the policymakers. And these are critical steps to actually go through in terms of implementation, and being able to actually implement and be able to measure the progress as you go forward. Thank you.
Okay, thank you so much for that overview. I think it was really important that you emphasize the necessity of standing up an AMR secretariat, because if that's not in place in a country, then as you said, it will often default to the health ministry. But that's contrary to a One Health approach. One Health approach necessitates involvement from health ministries, agriculture ministries, environment, and you're also bringing in finance ministries, et cetera. So I think that's a really important step, is to fund the establishment of a secretariat in each country. that's multi-sectoral. Thanks too for talking about the importance of engagement with donors, and building on some comments that Arshney made. I'd like to talk to you about how realistic do you think donors' expectations are regarding AMR in low and middle income countries?
Yeah. You know, by and large, I think the expectations are mismatched with the countries. And one would look, for example, most of the countries, in terms of African countries, they were supported to develop their national action plans. And it always actually surprises me and beholds me that we expect countries that were supported to develop a plan, we expect them to implement them. And so it's it shows you that they did not have resources to actually develop the plans. How can they implement them? And actually, I'll give you an example. Actually, when we developed the plan for Zimbabwe, it was costed around 44.6 million US dollars. That translated to about a 7.5 million investment a year. And the country did not have these funds at all. And so that becomes something that is, there's a mismatch there. But also I think one needs to look at that most projects that are done in the LMICs are guided by donor interests and not by country-driven priorities. And that creates also actually a challenge. And most countries really are challenged financially. I mean, technical resources, really, infrastructure, all these are issues to deal with, but also funders really continue to promote the silo interventions, the vertical programs. There's no integrations. There's no actually transfer of knowledge from one program to another program. And, you know, these are some of the things that, I mean, when one looks at the donor expectations that, oh, you know, we expect, and then again, what concerns me is that most of the donor-funded projects, they don't have a good exit strategy that will assure sustainability of this project post the funding period. And I think if those are built into programs from the start, and the country is involved in developing its own programs, in creating priorities, and they're part of the interventions, we are able to see actually that, I mean, the expectations of both the donors and the recipient countries can be matched.
Okay, thank you so much. I'm going to turn to my final question for you before turning to the ambassador. And then I'd like to ask a few more questions of you and Arshney. Final question for you for now, though, Murfin, is having worked with several funders in several different low and middle income countries, what do you think these funders can do to maximize the impact of their investments on AMR?
I think funders need to be able to work with countries in a collaborative way in developing the interventions towards AMR. They need to be cognizant of the situation of countries and not bring northern-driven interventions that have worked very well, but they lack context. And so they have to be contextualized in a country for it to be successful. But also I think the value of raising evidence within the country, using its own data, using interventions that actually they can relate with, that will actually cause most of the donors or funders to actually succeed. I think that's critical. Yeah, thank you.
Great, thank you so much, Murfin. I will want to come back to a few things and build on some of your comments. But right now, I would like to turn to the Danish ambassador to the United States. It's my distinct honor to introduce Ambassador Lorna Visborg, the Danish ambassador to the US. Denmark has made considerable progress against AMR domestically in recent years. And to address the threat of AMR in developing countries, Denmark is launching the International Center for Antimicrobial Resistance Solutions, or ICARS. I'm pleased that the Danish Embassy has partnered with CSIS to support today's event. And Ambassador Visborg, happy to welcome you. I believe we have you on audio, but not video. But either way, welcome.
Thank you, Kate. Can you hear me?
Yes, we can hear you well. Thank you.
Okay, thank you. And I apologize for not being able to join you on Zoom, but we had some insurmountable, apparently, technical problems, and I guess that's the world we all live in these days. But good morning or good afternoon to all of you listening in. I've been listening, via my phone to the debate, and I'm super happy that CSIS is hosting today's event during the World Antimicrobial Awareness Week. I know that a lot of really interesting events are taking place around the world these days, but I do believe that today's event is somewhat unique in its focus on a very important part of the struggle against AMR, which is moving from the national action plans into actually national action. And before I start my presentation, I would like just to start by thanking today's excellent speakers. We've heard already from Dr. Arshney Moodley from ILRI and Dr. Murphin Mapundu from React Africa. Thank you both for taking the time to join us and share your knowledge and insights on how and what to do at the national and local level to mitigate the threat of AMR. I'd also like to thank all of you who have joined us and are listening in. We're looking forward to continue the active discussion that you already embarked on. Effective antimicrobials are an essential cornerstone, obviously, of modern health systems and societies, and have been for almost a century. They are an integral part of our modern medicine and played a significant role in the development of our protein production, and will continue to do so in the years to come. They are essential for treating and preventing infections in humans, in animals and plants, and for life-saving interventions, obviously. But although they are vital for us, the use, the misuse, and the overuse also lead to failure of the very same antimicrobials as bacteria adapt and develop resistance toward these life-saving treatments. And therefore, AMR has become one of the greatest threats to health, society, and economies. And the World Health Organization has classified it in the top 10 health threats. Without sufficient action, AMR will simply jeopardize the achievement of the Sustainable Development Goals. And deaths due to AMR are projected to rise from approximately 700,000 today to about 10 million by 2050. That's more deaths than from cancer and diabetes combined. And the World Bank predicts the economic impact of AMR to exceed the financial crisis of 2008 and 9. And the bank predicts further that AMR will impact low and middle income countries the most. We know the AMR crisis is coming, and therefore we also have the possibility to get ahead of the curve, so to speak, if we act now and take prudent measures. AMR has been described as a slow-moving tsunami by the World Bank. But we also have to admit that there's no such thing as a silver bullet with AMR. The situation is very complex and has been described by experts as a so-called wicked problem. Solutions are not easy, cause and effect are entwined, but solutions are not impossible either. The World Bank assesses that investment in AMR mitigation is one of today's highest yield investments. And international awareness has increased over the last decade, and consensus exists globally on the high-level policies and interventions needed. In response, more than 170 countries now have a national action plan developed or in development, and several initiatives are established internationally and nationally. Yet, as highlighted in the final report of the United Nations Interagency Coordination Group on AMR from April last year, the global response does not sufficiently match the scale and scope of the issue, and challenges remain in implementation of national action plans, particularly in low and middle income countries. In Denmark, we have a long track record and working on AMR issues. As many other countries, we have benefited significantly from also its inherited danger. And the Danish government has for several years had a clear One Health AMR strategy. It is made in strong collaboration between the Ministry of Health and the Ministry of Environment and Food. And let me just give a few examples to illustrate. For more than 25 years, Denmark has traced all use of antibiotics in both humans and animals through the DANAP system. In 2010, the National Antibiotic Council was established with combined and coordinated efforts for the purpose of reducing antibiotic resistance and consumption in humans and animals. In Denmark, we recently merged the national labs for humans and animals at our equivalent of CDC. And for decades, there's been a very prudent use of antimicrobials for humans via targeted measures of reducing the use in hospitals, and campaigns have initiated in collaboration with private medical practitioners. Based on close collaboration between farmers, veterinarians, and the authorities, we have also significantly reduced the use of antibiotics in the animal production, while at the same time, the industry has expanded its animal production. And today, Denmark is among the top 5 hog-producing countries in the EU, and at the same time, we have the lowest use per kilo produced pig meat among the 5 major hog producers. We are among the countries with the lowest use in total in the European Union. Tackling AMR was at first a mostly domestic issue, also somewhat a Nordic and an EU issue, but with a track record in mind, we much more was needed and that it had to be dealt with outside our own borders and at the global level. Therefore, the Danish government increased its efforts in the European Union and at the global level. And in particular, I would like to mention that the Danish government back in 2018 and after consultations with partners such as the World Bank and CGIAR, launched a new initiative called ICARS, or the International Center for Antimicrobial Resistance Solutions. At ICARS, the emphasis on solutions focuses on assisting low and middle income countries with cost-effective and evidence-based specific solutions. It takes time and resources, obviously, to set up a new international entity, and ICARS will officially go live early in 2021, but it's already very much alive, and the center has already begun collaboration in countries such as Vietnam and Georgia, and more countries are in the pipeline. So the main points I would like to make in my remarks today are that we can and must succeed in the struggle on mitigating resistant bacteria, that the incentives for investments are quite clear and the yield is high, and that we need to work on country-specific solutions where we need to adapt a One Health perspective, and we will succeed in doing that through inclusive partnerships. With today's lineup of this, we have speakers with insight and knowledge from the global perspective and the local and perspective. And because AMR is a global threat, it needs to be dealt with in a national and local context. And before I pass the floor back to you, Caitlin, I would just very much like to thank CSIS for building a strong partnership over the years with the Embassy of Denmark. We thank you for your leadership and the outstanding work you do, but also a big thanks to the excellent staff at CSIS. You once again made it possible for all of us to home in on a very important issue. So thank you very much, and Caitlin.
Thank you so much, Ambassador Visborg. It's an honor to have you with us, and I really appreciate your remarks. They also provide a perfect segue into just a few more questions that I have for Arshney and for Myrfin. I'm going to ask a few questions of them, and then I'm going to invite questions from the audience. Participants are welcome to submit questions using the Q&A function at the bottom of the Zoom screen. So please feel free to start asking your questions if you have them. But back to Arshney and to Myrfin, I'd like to build on comments that the ambassador just made, where she talked about launching ICARS and how tackling AMR will take country-specific solutions. Now, Murfin, you had noted that that donors should not take a northern type approach to addressing AMR in low and middle income countries. Now, when I hear things like that, I like to get to really define what it is that you mean by an approach that's appropriate for low and middle income countries. Would you mind expanding on that? And then I'd invite Arshney to do the same.
Yes, I think I would. I think one of the great things that one sees with the approach that ICAS has taken, and most of the success actually programs, they've taken really a community participatory based approach in terms of really working with the country to identify what it thinks are its issues. For example, really, if one is looking at really interventions of this nature, one needs to understand the context and the major drivers of antimicrobial resistance at a country level. One needs to understand the structures that are in place, the legal frameworks, because, for example, if one comes in and says, well, I mean, they want to invest in really in stopping the sale of antibiotics really over the counter, and the country does not have enough pharmacy technicians, enough pharmacists, enough doctors, enough nurses, it's just gonna really fall flat in their face because it will not work. So you get into a country, you understand the context, work with the country to identify its priorities, especially now, even with the National Action Plan. I think one has to be careful because a number of these plans were cut and paste out of the Global Action Plan. And so they really are not built on a strong situation analysis. And so they may be countries that will think that, I mean, really investing in surveillance is their priority. Other countries might think, well, really investing in stewardship, investing in the animal sector, investing in the human sector, investing in the environment, maybe their priority. And so it's very important to work with that, but also looking at the capabilities, both technical, financial, and otherwise, because those also are part and parcel of what actually can work. And so the northern interventions.
Well, actually, Murfin, if you don't mind, I want to stop there and turn to Arshney to see if she has comments, and we'll come back.
Oh, I definitely have comments. And I think, well, Muffin is correct. You need this high level national sort of agreement on what the action should be. But I think important, it needs to be connected to what happens on the ground. The reality of those laws or regulations have to be implemented, and it's the person on the ground that has to abide by them. And that's really where I think a lot of the disconnect is that a number of the low and middle income countries do have certain regulations that govern how you should use antibiotics, but there is a disconnect between the two. And that's what Muffin is also addressing, is that we need to bring these two things together to have the success of an implementation of any intervention that will then be sustainable.
Thank you. For either of you, do any specific examples come to mind that you can share with us? And if you would rather not do that, I understand.
I mean, I can just base it on sort of the experience that we have from working with the informal market sector. So, I mean, the informal food sector is a huge sort of contributor of where people buy their food locally. I mean, a lot of the times in high income, we talk about export of food, but here the food that is produced locally is for the local consumption. And it's different if the food was going to be produced for export. And I think that that's also something that we need to take into consideration, is when we talk about livestock or agriculture, who is it for? And if the interventions are meant to be implemented, who is going to be the benefactor of that? Is it the local people, or is it people because of export?
Okay, thank you. Thank you very much. I would like to turn to, I have two more questions, but again, I would like to ask the audience and invite the audience to submit questions you have using the Q&A function. One thing that I'd like to talk about is the impact of COVID-19 on AMR. Now, do you see COVID-19 as something that is, as we'd say, sucking the oxygen out of the room and we have no capacity to talk about anything else? Or do you think this is an opportunity to address AMR because people right now have heightened awareness of the relationship between animal and human disease. So what's your take on that? And let's start with Murfin.
Yeah, I think the two are quite related. One is looking, actually, COVID is a very active pandemic, and then AMR is a silent pandemic that looms just actually underneath. And so, in terms of the implication that they have, I mean, the cost of life that they cause, and the cost on the economy, the cost on the food system is actually quite immense. And so one can draw some parallels, but also one can see that that actually the overuse of, antibiotics, especially for COVID, is a driver towards antimicrobial resistance. But I think one of the things that they both seem to be similar with in the health sector is that they are both actually health systems issues. If we've got strong health systems, we can actually address both COVID-19 and also antimicrobial resistance. So both actually can be managed. And what we have seen with actually the influx of, there's been an outpouring, coming together of countries, organizations to work together, creating a safe environment, providing some safe water and all that. If that sort of actually energy could be channeled also towards antimicrobial resistance, and we also use COVID-19 as a reminder and also as a catalyst to actually address real antimicrobial resistance, we can actually make some progress forward.
It's quite interesting. Thank you, Murfin. It sounds like you're saying that the health system strengthening that's necessary to tackle COVID will also have positive, will have co-benefits for the AMR fight too. That's interesting. Thank you for sharing that. Arshney, what are your thoughts?
I think that the impact of COVID has basically just highlighted all the insufficiencies in the various structures that we have, as Murfin pointed out. The other thing is the impact on the food system. And I think what COVID is doing is that it's pushing us into how do we transform, how do we think about food systems and moving towards building a system that is resilient to future pandemics. It's resilient to, well, how are we going to better produce food? Because with the closeness of animals and humans and sort of the risk of a new pandemic. So I think it's pushing also this One Health approach to addressing pandemics, food insecurity, food safety, and AMR is a part of that. And I think that that's also pushing the agenda of One Health.
Yeah.
Thank you.
What Arshney has just said, I think something that is important is that, one of the things that actually both COVID and antimicrobial resistance show us is that they affect beyond one sector. They actually affect multi-sectors, and Arshney is absolutely right. And I think that's the reason that our solutions cannot be focused on one sector alone, but they have to be really solutions that are cross-cutting and ensuring that we take that approach both at country level and at the regional and global levels. Thank you.
Thank you. Well, what you've both said is a perfect lead into my next question for you, which is going to be about a systems-based approach. And I'd like to ask this because this year the UN will be hosting a food systems summit planned for September of this year. So there's a lot of talk about taking a systems-based approach to fill in the blank challenge as it relates to food security. I think that it's important to talk about this. I think it's equally important to define exactly what we're meaning precisely what we're meaning when we promote this systems-based approach. So when it comes to AMR, what do you think a systems-based solution would look like? Is it anything different from what we're already doing under One Health?
I think for me, it is about looking at everything as connected and how we're connected to how the different systems are together. And I think it just kind of further highlights is that we can't just have one intervention in the healthcare sector. We sort of need to consider it livestock, aquaculture. We also have to consider building better infrastructures, facilities, improving sanitation. So I think this idea of, which in itself can sometimes be very daunting to think about the problem in a systems manner and how to address it. But I think you need it in order when we talk about cost-effective interventions and sustainability. So I think that that's the benefit of thinking about it in this huge broad term of interconnectedness.
Okay. Thank you. Thanks, Arshney. Mirfin, what are your thoughts?
I think Arshney is quite right. When looking at the systems approach, we're looking at a generalization that everything is interrelated, and so you've got actually units or elements that are working together to achieve one goal. And in this case, and the one goal that we're trying to achieve is to contain antimicrobial resistance, but also to ensure that the current antibiotics they continue working for a very long time. And so applying a health systems approach, really, it's addressing AMR in a coordinated and also expansive way that actually peels off the layers and works at the issues that are so connected, human resources. For example, if we introduce rapid diagnostic tests, like in the healthcare settings where I work, that is one element. But if we have not trained, it's good for actually helping us with diagnosis and really identifying the microorganism that we are treating. But if we have not trained the human resource that will use it, then we're failing. And so we have to train the human resources. There are supply chain issues that come in. And there are other actually areas, financing, and other areas that come in terms of infrastructure. And so a systems approach looks at a broader way and across sectors, trying to find how these linkages are and working to strengthen and working towards those areas that needs to be strengthened and maximizing, and also getting the low-hanging fruits that come out, so that we are not approaching AMR as just a single entity, or a single entity that only affects what it's really approaching it in a broader sense.
Okay, thank you. I would like to ask both of you a question from the audience, and then I will invite both of you to give any final remarks. If there's anything you'd like to say that we haven't mentioned yet, I'd like to welcome you to do that. But one question I'd like to ask you from the audience is about incentivizing implementation of AMR national action plans. Arshney, this is something that you mentioned, that incentives are often low in low and middle income countries. So especially the African context, do you have comments on how to incentivize implementation of these plans?
I think it's about firstly trying to understand that what is the connect between the current legislation that is in place, what factors led to the establishment of the legislation, and then how does that tie into the National Action Plan or even their One Health strategies. And then to then look at, well, what is actually happening on the ground, and then try to understand why is there a disconnect between the policy, the regulation, and what is happening on the ground. So where are the different actors, and to understand then the value chain in totality, to understand where are the contributions, kind of like you would for a hazard identification or a risk assessment, is to look at where the risks are, and then how can you then mitigate the different risks in order to be able to have the impact that you want at that level. But then at the basic level of a farmer, a smallholder farmer who you're asking him to change his behavior, means that you have to understand that he has an economy that is very precarious, with not a lot of flexibility and fluidity, and that his livelihood is very much tied to his animals. And so if there is a high burden of infection, how do you reduce the burden? And then at the same time, how do you tell him to not treat his animals, to wait to see the long-term effect of reducing antimicrobial usage? And I think that is something that is very, very difficult to understand, is that, yes, in Denmark, when you had the ban on usage of antimicrobials as growth promoters, but at the same time, you had a number of other initiatives that were then on top of that to ensure that the dip in production was not big enough, that was felt negatively by the farmers and the economy. So that approach also has to be taken in low and middle income countries, is that when you say don't do something, you need to be able to offer another solution that is at a cost effective, that doesn't hurt the pocket of the farmer or anybody else. Similarly, with people buying food, how do you improve food safety? And I think we can draw on a lot of the research on improving the safety of food that we can then also implement in other, with addressing AMR. And so we shouldn't try to reinvent the wheel. Is how can we utilize a lot of the information that is already there and repurpose that for what we want to do?
Yeah, thank you. It's such an important point. If you're going to regulate certain activities and say this is not advised, and what is it that you do advise? What is it that you are making an option for farmers? That's really important. Thank you. Mirfin, do you have comments on incentivizing the implementation of these plans?
Yeah, I mean, Arshney has. I think funding institutions need to work. I mean, the World Bank and other institutions, they need to work with countries to be able to provide these sort of incentives. I think very clearly, if you stop or you want to actually reduce the usage of antibiotics as growth promoters, for the first few years, maybe they'll be making so many losses. Who swallows that? Like Arshney was saying, if you want to remove actually from these pharmacies that sell antibiotics without a prescription, what are the alternatives? And I mean, I face those questions so many times. We raise about 30–40% of our income in selling these molecules. So if we stop selling them, what's the alternative? And so, it's more than, they have to be incentives for people to do. And we see that even in behavioral change, actually, when people are doing, the reinforcement, when behaviors are reinforced, that are good behaviors, they are rewarded, then people tend to do far much better. But actually, I think my closing comments are just that, yes, this is a major challenge that we have, but I think we can work together. And I think one of the things that we see with, COVID, and we see with AMR especially, is that it affects so many of the sustainable development goals. Without addressing it and being a very, very optimistic, aggressive, focused, and putting everything together, will not be able to achieve the Agenda 2030 at all. Thank you.
Thank you, Murfin. Thank you so much for those closing comments. Well stated. Thank you so much. Arshney, closing comments from you?
I think we should not give up. I think while the task seems like it's insurmountable, we should continue. And I think more importantly, what we need is data from low and middle income countries, as well as analysis that show that the interventions work in the context that we find ourselves and want them to work here. And that's what we need to be investing in, is that can we show farmers that you can improve, you can do good, have livestock production that is not going to be detrimental to human health, that is not going to be sort of using land in a poor way, so sustainable agriculture. And how do we do that while we intensifying, because we have to feed more people? And that was, that is the agenda of the UN summit, is that how do we feed people, but still maintaining, we maintain a happy environment, and we still do, we still are able to feed people. And I think that that's an important thing that we need to think about as we move forward with our agenda.
Thank you so much, Arshney. As I said at the beginning, I think we have no better guests, no better experts to talk about these issues than the two people who joined us today, than Arshney and Murfin. So thank you to both of you for joining us today. And again, I'd like to thank the Embassy of Denmark in Washington. And thank you so much to Ambassador Lorna Visborg for joining us today. Thank you for the Embassy for your partnership. Thank you for your partnership in raising and sustaining attention to this critical issue. We look forward to continuing this dialogue. And finally, I'd like to thank our audience for tuning in.